Hi, Dr. Yan. Can you tell us about your job?
Hi, I'm a practicing geriatrician. I work with the seniors, and I work in an acute care hospital. I work in clinics, and I go to long-term care facilities as well and look after seniors.
And what factors can affect mental health in the elderly?
Well, there's a lot of factors that can affect it. Um, Aging is often punctuated with a lot of losses. So, uh, retirement, so loss of income, loss of physical function, loss of cognitive abilities. Um, so a lot of things can affect the mental health of a person. So that can happen spontaneously without any precipitating factors. It can also happen together with the onset of certain losses as well, as I've said. For example, loss of a spouse, loss of friends, loss of social network, social isolation. So these are all different factors that can affect it.
Oh, I see. And what are the common mental health disorders you encounter in your job?
Right. It's certainly different in different kind of settings. Let's say in the long-term care kind of setting, I would think that the most common things that I see would be people with dementia, people with depression, um, people with functional decline.
Okay, and what can we do to improve the quality of seniors' life?
Right. Well, for people in the long-term care facilities, usually there is something that would make them unable to live on their own or live with their family in their own environment. So there's a sense of loss there, loss of independence. Um, I think it's important that we recognize that so that we can work towards restoring as much independence as possible. Um, so very often there's also a sense of abandonment as well in these residents. They don't feel that the family is caring for them anymore, so they're kind of dumped into this new place and let them just live on their own. I think what should happen would be that the family would work together with the long-term care facility, and so that they would provide some kind of programs, activities for the seniors and let them live as kind of normally as possible. Of course, with the physical limitation, with the social limitation, that is not easy, and I think every party concerned should be trying their best in order to provide an environment for the senior to live as happily as possible, and that would also be important for the quality of life of the resident.
Oh, by the way, Dr. Yan, how can family members contribute to improve the quality of life for elderly?
Well, I think there's a lot of things that the family can do to achieve that aim. And being the family member, of course, it's important to spend more time with the senior. And after all, that's their loved one, and I think it would be nice if they would be able to visit more often. Now, due to a number of different circumstances, um, technically it may be difficult to do it all by themselves. It would be best if there is a family with many family members. That may not be possible. If that's not possible, then I think the next best would be to hire someone to attend to the needs of the senior. So it could be physical needs, emotional needs, and I think that would be helpful. I think it would also kind of decrease the sense of abandonment that I mentioned earlier. That would be common, and they would have to talk kind of very frankly, and so as to clear any misunderstanding between them, and be more acceptive and help the seniors to accept the losses that they have,
Thank you, Dr. Yan, for your time.
No problem. Thank you.